Hello. I'm not sure if I'm exactly live yet, so okay. Hi, beautiful people. I'm April Roll, your ER doctor online and a member of Rodocs. Today is July 24th, 2020, and today I want to talk to you all about some misconceptions about hospitals and hospital systems, how the hospital works, and what you can expect when you go to a hospital. So, to start off, one of the most common things that I hear patients say when they arrive to the ER is, um, you should have my records, or you can see my records, right? That's a common thing that I hear patients say. And I just wanted to address it because not all hospitals are created equal, whether they be in the same zip code, area code, state, country, 5 minutes away from each other. Not all hospitals are created equally. So if you've gone to one hospital, it could even be within the same month or the same week, and you go to a different hospital that's under a different system, a different corporation, or it's a community hospital versus an urban hospital, or a government hospital versus private hospital. Um, that will affect whether or not your records can be automatically accessed from one hospital to the next. For the most part, your records cannot be accessed from one hospital to the next. And the misconception that I want to clear up is um, everyone's records are not interconnected in some nationwide or even statewide or citywide database where your medical records, labs, imaging, visits to your primary care physician or to the ER or to the hospital, they are not interconnected electronically or through the internet or anything like that. Even within hospital systems, for instance, in the South Florida area, Broward, Palm Beach County, Miami, you may have heard of HCA hospitals or Tenet hospitals or Memorial System hospitals, and neither of those hospitals are linked together. So, for instance, if you're in Broward County and you go to Westside Regional Medical Center 1 week or 1 month, and then you go to Memorial Regional Hospital the next time, those two hospitals cannot automatically access your records from the one hospital and vice versa. You would have to do what's called fill out a medical records authorization form for release of your medical records. And then the one hospital can fax your records to the next. So that's the first thing that I kind of wanted to address in terms of patients having a common misconception. It is that all hospitals do not have access to all of your medical records just automatically throughout a nationwide or statewide or citywide medical record database. That's the first thing. The other thing that I commonly hear is when a patient arrives to a hospital, they expect that that hospital will have every specialty and doctor available 24/7 for them to be seen at the hospital on the day or moment that they arrive. So this also goes into the fact that I was talking about before, all hospitals aren't created equal, and especially with corporations owning hospitals, usually within a network, you'll have this hospital that specializes in cardiac conditions or cardiac procedures. For instance, if you have if you're having a heart attack and you need to go to the cath lab, you need stents placed in your heart for the heart attack that you're having. or you need a cardiac bypass surgery, something like that. Not every hospital specializes in treating or managing an active hospital or things related to conditions with people who have history of a cardiac bypass or CABG as we call it, or stents in their heart. Not every hospital has a cath lab that you can go to emergently. Now, I don't want to, get it misunderstood or have you think that you can't go to any ER. Every ER will treat, see, screen, and basically do a medical screening exam for any patient that arrives at the ER. Any patient who arrives at an ER will be seen, will be examined, and certain exams, tests, imaging will be ordered to determine whether or not you are having a medical emergency. And what happens from there is you will either need to be admitted to the hospital, or if you're not having an emergency, you will be discharged to follow up with a primary care physician or a specialist. So that's what usually happens in the ER. But in terms of does every hospital have everything? No, that is not the case. Like I said, some hospitals have a cardiac center, or they have a stroke center, or they specialize in cancer treatments, or they specialize in transplant surgery and transplant conditions, follow-up management with patients who have history of transplants, or they're a children's hospital, or they specialize in women's health. So I just wanted you to be mindful that not every single hospital is going to have specialists there 24/7 to see and manage whatever condition you show up to the emergency department with. So those are the two that I kind of wanted to get out of the way that I hear all the time, that patients kind of believe about all hospitals. The other things, I just have some notes here. I kind of touched on this, but you have for-profit hospitals, not-for-profit hospitals. You have hospitals that are owned, operated, and run by the federal government, such as VA hospitals. You have teaching versus non-teaching hospitals, where in some academic facilities, you have teachers and you have learners. So there are students there, for instance, medical students, nursing students, fellows, meaning that they're already a doctor, but within their specialty, they are training for a subspecialty. So those are teaching hospitals where you're going to have people who are actively learning to practice medicine and receive some type of certificate or degree for their training. And then you have non-teaching hospitals where it's not an academic institution, so you don't have any students there. Everyone who works there is a doctor or a nurse or whatever the case may be. They already have their certification, they've already been trained, and they are no longer a student. So those are some broad categories for the different types of hospitals. Like I said, some hospitals are owned and operated by corporations, and within those, you have specialty hospitals that manage or specialize in or excel at certain conditions, organ systems, or specialize in taking care of a certain population of people. One of the most common things that I can bring up is pregnant women. So, for instance, not every hospital has obstetrics and gynecology or a labor and delivery floor or ward or department. So that's something that everybody knows what a pregnant woman is. Not every hospital has a labor and delivery department. So that's just one very common, everybody knows what a pregnant woman is, delivery of a baby. Not every hospital has a labor and delivery suite and or obstetricians 24/7 to deliver that baby. So those are just some common things I wanted to put out there. What to expect when you come into a hospital. Expect that there may not be a specialist that you're coming there to see, but we definitely in the ER will see you. We will examine you. We will coordinate whichever type of care you require in order to treat the condition that you are showing up with. As well, this day and age, we have telemedicine. So that is a viable option for you to be seen, for you to be evaluated by a medical professional. Again, I am a member of RODOC, so I also see patients through telemedicine. The information is in the description box to the left or below, depending on how you're watching this. I am glad for all of you who have taken the time to join this live video. If you were not able to catch this live video and you do have questions, please put them in the comment section below. If you learned anything from this video, please share. If you would like to schedule a telemedicine visit with me, again, the information is in the description box, rodocs.com/Dr. April Roll. Thank you for joining this live with me. Be blessed and stay healthy.